Does it have the potential, in your view, all of you, to replace bone marrow transplantation with simply this drug?
So it's not a curative therapy.
Okay.
Bone marrow transplantation has a curative intent.
But let me be the devil's advocate here.
Right.
We have lots of diseases that we
Yes.
treat very effectively that aren't cured.
Right.
Heart failure, we can't cure diabetes, a lot of
Absolutely.
stuff.
Absolutely.
Doesn't mean it's no good.
Absolutely. No. So I don't think that every patient is going to go through bone marrow transplant. I don't think every patient is even going to be eligible to go through gene therapy. You know, you have to be in good shape to undergo an autologous bone marrow transplant to get gene therapy.
Okay.
Not everybody's going to be able to do that or is going to want to do that. And so this would be a very good alternative to reduce the transfusion requirement, reduce the iron overload that results from that increased transfusion. So you have decreased red cell units going in, you have decreased iron going in, decreased iron overload, reducing your chances of iron-related complications, right? So it's definitely a good drug that you would use at this point in any adult. I would offer to any adult who has a regular transfusion requirement.
So to just sort of lay it out, it's not curative. Which if a curative therapy would say you're off transfusions, your bone marrow is fine, you're all done.
A percentage of patients are becoming transfusion independent. So we need more time to follow.
I mean, if we're going to talk about bone marrow transplantation, the word cure is a powerful word, right? We're done. This disease is gone, right? Short of that.
But not in 100% of the patient, eh?
Right. Nothing's 100%. Aside from that, you can use, we suspect, based on the results so far, a drug which is well tolerated, which decreases transfusion requirement and may, in some people, get rid of transfusion requirement and extend not only their life, but their quality of life. Did I get that right?
Yeah, I think you did.
I'm hitting something right anyway.
But you have to add a point for bone marrow transplantation. We know by the old data produced that as adults are the transplanted patients with some complications such as liver fibrosis, severe iron overload and so on, the outcome of bone marrow transplantation is not as good as in children. So if you ask me what I do, if I have a patient 40 years old asking me for bone marrow transplantation and probably he has to go to an unrelated bone, I say, listen, we can discuss, but it's not the best choice for you. Whereas with a pharmacological approach like luspatercept, I should say that I can offer it to anyone.
And it's effective in adults. Is it effective in children? We don't know. I heard that
we don't know
We
yet.
don't know.
We don't
Is
know.
there a trial ongoing?
Yes, it will start in January, yeah.
It's going to start.
Yeah.
Very soon. So this is groundbreaking stuff, really.
I think what's also important is it'll be really exciting to see this then being used in more patients, to see in the adults who have other complications, are we seeing improvements? Are we seeing, with less transfusions, are we seeing less iron overload related complications that affect the morbidity? What about pulmonary hypertension? Like, that's going to be really exciting to see by raising the hemoglobin, by changing affecting the erythropoiesis, are we seeing down the road benefits?
Osteoporosis mainly
is a big
Did the
one.
study go on long enough to get a handle on the iron overload issues with this disease?
Probably not. So they looked at iron by the serum ferritin level and they looked at iron by MRI. So on the serum ferritin level, which is a reasonable marker but not the most reliable marker of total body iron overload, there was a statistically significant reduction in the serum ferritin levels of patients who got the luspatercept versus placebo.
Okay.
They didn't have any statistical significance on the other two, probably because it does take longer to see those effects.
Okay.
But as they go out, so the drug is now in an open label extension phase, and they're collecting data on those patients. And so we will see more data on the iron parameters, on the bone density, on all of those other complications. We'll see data down
Yeah,
there.
that was the import of my question. Those things that come on slowly go away slowly.
Right.
So the iron may be a late benefit, if you will.
It was hard to really evaluate the iron in the course of this, of this study. But obviously, if you decrease the number of transfusions,
You decrease the iron
yeah,
intake. But probably is even more than that. It's not only the iron intake reduction, but probably we mentioned before the dysregulation of iron metabolism. Probably some accumulated iron will be used to produce hemoglobin. So that
So,
will be
you'll
removing.
suck it up
yeah,
all on your own.
exactly. Yeah.
That's really interesting.
Yeah.
Well, but I mean, normal people recycle 25 milligrams of iron a day,
Okay.
and they only absorb 2. So the largest source of iron in normal people is the recycling of old red cells. And so if you turn on the ability to make red cells, which is what this drug does, then maybe you'll utilize more of the iron.